Alternative medicine, exploring your choices in natural, Eastern, and complementary medicine with our reporter, Laura Windsor.
Sometimes chronic illness can be so debilitating the patient can't even get out of bed. Sometimes chemotherapy is not an option for an individual. To find out how a naturopathic doctor approaches debilitating chronic illness, we talk with Dr. Shannon Sinsheimer in Rancho Mirage, California.
Chronic illness is usually going to be diseases that are autoimmune conditions, such as MS, multiple sclerosis, RA, rheumatoid arthritis, in a severe case, Wegener's granulomatosis. So chronic illness means that it doesn't go away, but you can have varying degrees of discomfort from the disease at different times throughout your life. Chronic illness is usually a palliative treatment, meaning that you treat the pain, you treat the discomfort, and find a way to decelerate the disease process. So when you're treating it, you're not treating the condition, but sometimes the symptoms of the condition.
My eye was red and my joints were swollen. My knees, my ankles, my elbows, they were swollen and I could barely walk. After going through that for some time, being admitted into the hospital, being referred to a rheumatologist, he diagnosed me with Wegener's. It's an autoimmune disorder. He wanted me to start chemotherapy. I said that that's not an option for me. You know, I have a baby at home, I have to work, and I don't have time to be getting sick, losing my hair over something, you know, that can be managed other ways. And so then after that, I started looking up naturopathic information, curing stuff naturally. And then I seen Dr. Shannon. She was calming and recommended me a whole bunch of different kind of supplements. The labs came, the numbers went down. My rheumatologist was shocked.
Naturopathic care treats the underlying cause of the disease. So in the case of Demetra Porter, where she has Wegener's granulomatosis, it's a condition of inflammation of the small and medium blood vessels. When I treated her for Wegener's, I treated the inflammation, of course, because that's the pathophysiology, the disease process, but I also treated her GI system because her GI health had gone off a little bit, treated her to make sure she was digesting the nutrients and eliminating waste appropriately. I treated her emotional well-being. She was extremely distraught when she came in. She had a 10-month-old. Her body wasn't functioning. She was barely able to move. Obviously, the emotional distress was increasing and exacerbating her condition. Wegener's granulomatosis 30 years ago would have been a condition that could be potentially lethal. In the naturopathic way, I look to support her body functions, support the cells, support the joints, support the inflammation process, meaning that I gave her agents, therapeutic, natural agents, that would decrease inflammation by supporting the cellular function.
You know, it's not always good. I'm telling you this, I wake up sometimes and I'm like, oh, you know, oh, my eye hurts, you know. Oh, I'm in pain, I don't feel like doing this. But you know what, I'm glad I can get up because there was a point in which I couldn't get up out of bed. My feet were stiff. It would take me like almost 2 hours just to get out the bed. I'm able to walk. I'm able to go to work. I'm able to do doubles. But it's okay. It's my choice.
For Discoveries in Alternative Medicine, I'm Laura Windsor.